What's up, everyone? Dr. Dan over here. We got James. You've seen him on some previous videos learning how to pulse, which we're gonna film a follow-up pulsing video today too. But James actually had a little ankle injury over the past week, so we're gonna show you how we typically will treat a ankle inversion sprain, right? So if you wanna go ahead and lay flat on your back for me. And this was actually about, what, 2-3 weeks ago now,
yeah,
right?
about 3.
Okay. So Bree, do you wanna maybe come down? And,
yeah, for sure.
Right? So a couple things to note. He sprained this left ankle, and if you can see on video, you can see how there's like a little bit of swelling. It's already much better than what it was last week. Ankle's back down to almost normal size, but there's still just a little circumferential swelling in the left ankle, and we saw he had some connective tissue and muscle damage up in the lateral side of the leg, right? So if we can see, maybe you can shoot like straight down here, okay, and you can see right foot versus left foot. So you can definitely tell how there's a little more, just a little bit more of inflammation and swelling out here on the left side of the ankle. And I'm just gonna palpate around. Is this tenderish right in here?
Yeah, it's
still a little bit tender, right? And scooch up a little bit on the table for me. And then good, head down, okay? So we can also see one more time shot right through here. You can see how this left ankle is a little bit more inverted, right? Compared to the right ankle. It's not much, but if we look at his heel, his big toe, this left ankle is a little bit more twisted. And when we roll and sprain an ankle, we roll it this way is the most common way to sprain. I think, what did you do? You stepped on a rock while you were running, right? Okay. So that guy's good. Actually, there, that thing just adjusted, so much better today. What I'm checking for is his ankle mortise joint, basically the movement in between his foot and his ankle. And this right ankle moves nice and easy. The left ankle today also moves pretty easily. So he's regained some of his mobility after the original injury, okay? But what we're gonna do today is a little instrument assisted work. So some fascial release, some muscle work to his lateral calf, the back of his leg, to help push and flush some of the swelling that was present here for the past couple weeks back up into his leg. We'll show you some foot adjustments, and then we will we'll get him nice and mid back, low back, all the treatment worked out there, okay? So can you squeeze your right toes? And go ahead, relax, and squeeze your left toes. Okay, so there's still some pretty significant difference here, correct? So if we look down here, squeeze your right toes, and we see we've got pretty good toe flexion. Squeeze your left toes. Definitely a little less on the left foot. Point your right foot down, squeeze your toes. And again, you probably feel a little tight, a little tension right up in the right side. And then let's do that on the left side. Still a little tight on this side, okay? So when he rolled his ankle, when you roll or sprain your ankle, you can develop, well, you develop ligament damage and some connective tissue and even some tendon damage down here in the lateral side of the foot. So again, we're gonna do a little muscle work. We're gonna show you how we treat an ankle sprain, adjust his toes, and then give you some at-home foot exercises to help rehab the ankle. Cool? All right, bend this leg up, bend your knee, just put it right there, okay? And so we'll see you guys later on. So we're gonna do some really light fascial, myofascial instrument release work over the top of his foot, right where he sprained the lateral side of the ankle, right? So the most common type of ankle injury, ankle sprain, is an ankle inversion sprain. And that's when you roll the foot in and you damage and stretch out all the ligaments on the side of the ankle. Again, this happened about 3 weeks ago, I think. And he was really swollen up for the first 2 appointments. Today is looking much better, but you can still feel a little tension, correct?
Yeah.
We're doing some really light fascial mobilization to help promote blood flow, reduce some of the stickiness, some of the tension down in the lateral foot here. We're going to promote blood flow, and then what I'm doing now is just finding, you can feel a little bit of that restriction, right? Yeah. So if you watch how this tool glides, you'll see how it kind of gets a little sticky. There's some sticky spots, like right here. There's two of them, right here and right here. And you can see how that tool kind of sticks. And so this helps us to just basically iron out some of the connective tissue and the ligamentous tissue. And really, when we see this little nerve, you can see that line right there. See that little line right there? So that is that's one of the lateral nerves on the side of the leg. And when he rolled his ankle, it also causes damage high up here. And so a lot of times you can have like ongoing toe and foot pain after an ankle injury. All right, so squeeze your toes, and that's already, can you tell how much more? So if we look at the previous toe squeeze, go ahead down, and he's getting a lot more. Okay, point your foot down, a lot more toe dorsiflexion, toe flexion. Cramping a little bit? Yeah. So he's got some inhibition, some weakness on the bottom of the foot. You can't feel this in the video, but if you work on pushing your toes down, pushing your foot down, squeezing your toes, your plantar fascia may cramp. See how that happens? So today you're going to work on this, right? Tonight, tomorrow, next couple days, you're going to continue to work on strengthening the plantar fascia. Point your foot, squeeze your toes, gently turn your foot in, right? Try to feel the bottom of your foot right here work. And that's what's going to help, remember, as we told you last appointment, this lateral side right here, okay? All right, let's do a little bit more. So turn in. We're going to get a little more aggressive down around this tendon. All right, good stuff. Let me grab one of these. And then we're going to foot up, toes down, way down, foot down too, excuse me. Foot up, toes down. Foot up, toes down. What we're doing now is just some myofascial release up the lateral side of the shin or the tibia, right in between the tibia and the fibula, called the anterior compartment. And you can feel like right through here, maybe a little bit of tenderness. Yeah. You can feel there's a little bump. Remember last week it was way worse, right? Yeah. So what we did, we pushed some of the swelling, the fluid, the old dead cellular material back up into his ankle. And now we're going to get it higher up into his leg so his bloodstream, his circulatory system and his lymphatic system can drain all the damage from the old ankle sprain. Let's go toes up and down. And up and down. Okay, both feet down. Relax that. Good. Okay, so we're going to work today at home. You're going to do foot up, toes down, squeeze. You're going to breathe into your core, and as you exhale, squeeze your toes. We're going to work on rehabbing the bottom of his foot. Breathe in, breathe out, squeeze. Okay, 15 times here. Got that? Yeah. Second exercise, foot down, toes down. Okay, that's where you're going to cramp out a little bit, right? Yeah. Okay, all right. Good. And we're just doing little foot adjustments. Relax that left. Good. All right. Bend this leg up. Good. Okay, so he's moving great down below. Let's go face down on the table for me. We can see right leg is the non-sprained leg. Left leg is the sprained leg, right? So you can see the inversion here on the left leg. You can also maybe notice in the video the calf or the soleus size difference, right? So here to here. So he's got a lot of swelling on the inside of the leg and also a lot of overactivity of the medial calf and then the one of the other muscles called the posterior tibialis. So when he sprained his ankle, he rolled it in and that disrupts the balance between the outer and the inner leg muscles, right? So I'm going to do a little myofascial release on the inner portion of his calf right here, or a little instrument work. And you guys can't feel this, but he feels this. Which actually is a lot better, but there's a little bit right through here, right? A little bit of tenderness, isn't there, dude?
Oh, yeah.
A lot of tenderness still.
Yeah.
Okay, relax right there for me. And same thing, after we do the fascial or the instrument work, the fascial release, I like to get deep down in the calf muscle, feel right there. That's where he's got this little calf hyperactivity or overactivity. And I just need you, James, to breathe deeply. Toes up towards you, like that. Down, up, down, up, down, up, down, up. Down with your foot, up with your foot, down, up. Okay, so he's got a little bit of ball of tension up here, a little bit of swelling down in the lower portion of the ankle. We're going to give him a stretch to work on. Basically, you have muscles that run the whole way down the inside of your leg and the whole way down the outside of your leg. So when you roll your ankle, it can stretch this whole leg out. It can cause hip, opposite side shoulder, sometimes same side problems. So I'm going to show him how to do a nice leg stretch for his calf today so we can start to neutralize this ankle. All right, my man?
All right.
All right, we're gonna get him adjusted. Stay right there for me, dude. And James, he's always good to move. So we've also been working with James on some diaphragmatic breathing and some postural work. Go ahead, take a deep breath in for me. Exhale out, whole way exhale. Breath inhale and exhale out, whole way out. Breath in and exhale out. Good. Okay, good job, man. And previously, what, a long time ago, 2 months ago, you were having a lot of like right shoulder discomfort.
Yeah. Oh yeah.
All right, and then on the left hip, remember I told you about how this ankle sprain can mess up here, right? So you feel a little bit of inflammation, a little bit of crunchiness up in this left SI joint. So face me over this way, left side up for me. And we're gonna go straight up, boom, boom. Leg like that. We're gonna go down in sacrum today. Breath in, breath out. Good. And other side for me. But you're
moving way more.
moving good, right? Breath in, breath out. Whole way exhale, whole way out. Good. Flatten your back tonight. Okay, bend this left knee. Just relax your left. Good. All right.
Yeah, it's really tight.
Push into my hand here. Stop. Push. Stop. Push. Stop. Push. And stop. Okay, feel that left side?
Yep.
Let's see what right side's like. Still a little tight.
That's
Push.
good.
Stop, but no major difference though. It's actually a little better. Push.
Yeah.
Stop. And push. And stop. Okay, man, up to the neck. Put your hands right in your belly for me. Okay, neck's always good for him. Relax this left. Good. One more hand to the right. Awesome, man. All right, cool. Sit up straight for me. That's it. Got his foot worked on. Why don't we show you what stretch we're gonna do, right?
Yeah.
So this is, we're in little crammed quarters here, but let's look over here in the picture. So we've got a line of muscles that goes from our groin the whole way down this medial calf, right? So when we look at your ankle, we see after you sprained the outside of the ankle, your heel, it kind of rolls in a little bit, right? So you could feel how balled up this calf is.
Right.
So I'm going to show you a stretch for this whole line of muscles up into your groin. And what it's going to do, it's actually going to be a hip tensioning exercise. Okay? So you're going to stand, face the camera. Bree, you might want to work over there. You're going to put your left shoulder right against this wall. Both feet straight forward. This leg comes up here on the table. Okay, now here's the deal. Foot, you see how it's pointing downward, right?
Yeah, yeah.
Foot straight forward, like that.
Okay.
Now you're going to stand up nice and tall. And what we're going to do here, you're going to press your foot 50 down, 50 down. You're going to feel this like up the inner leg. What I want you to do is just use your left leg, stand up nice and tall, and I want you to feel your hip right here, how it's kind of opened up a little bit. So we're going to work on turning in gently and feeling this nice stretch down the inner leg. Now as you do this, I want you to keep your knee straight. Now this is the good leg, right?
That's a good leg.
Okay.
Yep.
So take a deep breath in, exhale, press your foot down, and just try to stand up nice and tall, and I want you to feel your pelvis rotate just a little bit. You see how tight this side is? So the movement itself is just going to be a foot press down. And if you want to add in a little bit more lateral flexion, we're going to lean into it. We're going to stand up tall, and we're going to let that hip rotate right in like this. And you're just going to kind of feather this movement right through the hip like this. Trying to keep 50% pressure through your heel, 50% through your big toe. And I even want your foot like that. Straighten your knee now. Boom, right? Oh, and then we rock the hips in and out, okay? See how this feels?
Yep.
It's important that we keep both feet parallel forward. So turn around, let's do that other side. So you're gonna do this at home, close to a chair or a wall. Right leg goes way over here, okay? Now, foot here, straighten the knee. And now you're gonna work on just turning in, standing up tall, in and out.
Yeah, it's way tighter.
Way tighter, right? So the whole inner portion of the right or the left calf, left leg, left groin, boom. So you see how we're just kind of feathering, I call it feathering the hip in and out. Basically his hip socket, we're just moving it like this, and you're gonna really work on pressing down through that toe, straightening the knee. That's the movement that we wanna create is tension up here. If you lean into it a little bit, you might feel like this muscle really kind of cramp up a little bit.
Right.
Turn into it a little more, right? Boom, boom, boom. You're using your right leg to just kind of power through. Does that make sense? Or press down through the big toe. Straighten the leg, right?
Yeah.
Take a deep breath in. As you exhale, press, straighten. This is a good activation. Roll the foot in a little more. Boom, straighten the knee a little bit more. Okay, and we're basically just helping to reorganize his muscle and connective tissue on the outside of the leg to take some of the tension on the inside of the leg. Does that make sense?
Yep.
So part one, feather the hip. Okay. Part two, press down through the foot. Part three, straighten the knee. Lock it all out. Take a deep breath in. Exhale, press, straighten, maybe roll, tie it all together. Got it?
Yep.
So that's a good pre-warm-up and post-cool-down. So if he's going to be running, this is a good hip opener for him to work on prior to running for just a couple minutes each side to really help open the groin up and activate the glute up here. You probably feel like this glute wants to maybe cramp compared to this side. If we lean into it, roll the hip into it, right? You see how we kind of really isolate the obliques, the glute med, the TFL, and you can feel how much tension you're creating up there, don't you? So this tension, when he rolled his ankle, you basically disrupt the whole leg, and it can have problems the whole way up into the lower back. Cool?
Yep.
All right. right, so spend a little time doing that this weekend.
Okay.
Again, if you are, close to a chair, feet parallel, foot up, upper body straight, and we're just going to work on feathering the hip, maybe even leaning into it a little bit to get that nice stretch down the whole inner side of the leg.
Cool.
Cool?
Yeah.
All right. That's his ankle sprain. That's an ankle inversion sprain we just worked on. We did some myofascial release to the inner calf, the posterior tibialis, the outside of the foot, so like the peroneal compartment to help reduce some of the swelling in that anterior compartment. If you have an ankle sprain and you don't treat it the right way, sometimes you can end up developing like numbness and tingling down in the toes, chronic foot weakness, and also your hips, your lower back, the whole way up the kinetic chain can become imbalanced. And so months down the road after you sprain an ankle, if you don't treat it the right way, it can cause twisting and imbalance the whole way up into your body. So get those things checked out and fixed up. Cool?
All right.
Thanks, man.
Yeah.